To begin an exam, you're going to start with the patient ID right here. You'll press and then you'll have a keyboard pop up here. Looks a lot like the iPhone or iPad keyboard. Patient ID is automatic. It goes by the date, such as the year, the month, the day, and how many patients of that day. You'll enter the name. I'm going to enter by pressing here. I'm just going to enter test. Backspace here. The gender, set it female. I'll change that to male. Last menstrual period for any obstetric exams. It's not highlighted here. You enter the birth date and any other information you might have. Down below, you can enter extra information about it, or you can search for a patient ID in case you've used that patient before. You can search them. Again, that's something else we'll get into a later movie. Right now, we're just getting started. I'm going to click Done, and then I'm back to the imaging screen. Here we have the patient ID and the name. Now if we want to get into an application, we'll touch Application. This is going to bring up a body, and these are the things that are available with this linear probe right now. You can change it by pressing here, such as a fetal heart, going back to male patient, female patient, baby. Those kinds of things will change the application that you're going into. For a male here, you can see how the anatomy changes. We'll go into just a vascular. That would show the carotid. Now, on this display here, you'll see Para 1. This is the first set of parameters. There's a second set of parameters that I'll show you how to get to in just a minute. We also have your TGCs. To change your TGCs, you can just slide your finger along here or change each individual parameter by pressing it and dragging it. And you'll see how it changes here. That will appear for 1 second after you change the parameter, and then it will disappear. Here in B mode, we could press it and we get multiple menus. Each time you see an arrow here, it means you can pull up another menu. Back when I chose the application, you'll also see the arrows here. If I press that, you'll also see Save, Import, Export, and Default. We'll get to that later, but that's how you would save a custom preset after you make all your changes. To go to the application, don't push the arrows, push the other part of the button. I'm going to click X to get out of that. Here, we push down the arrows, and we have pulse wave Doppler, 4B, 2B, and B mode. B mode is your standard 2D imaging. PW is pulse wave Doppler. 4B is your quad screen. 2B is your dual screen. Here we have color. We'll press color to get into color mode. Left, right, biopsy. You see the little arrows here. We can also get a center line to appear or not. Choose biopsy or center line. Here we have the others. This is where we get into a second set of parameters. If I say other para, I get another set of parameters here that will show more in-depth customization of the image. If I push others again, we'll also see setup. This is where you'll get into the custom setup of the system, such as your clinic or hospital name, annotations, library, things that we'll get into in a later movie as well. It's beyond just the quick tour. Archive is where you go to previous patient information to pull up previous exams or images from a previous patient. Print, it's where you print to a report printer. You can also have other printers set up. There is a full thing to get into setting up custom printers through the USB port. We'll close here. I can click back to get back to my first set of parameters, back to the TGCs and Para 1. Down here we have needle, lock, and a trash can. This pulls up a needle guide. If I press needle, this is for image optimization for doing some sort of needle guidance, where you would put the needle parallel to this line. Needle angle changes the angle of that needle depending on how you are coming in with the needle. Down below on this information we have the power button. We can do this. We can hit it to shut down. This is the percentage of hard drive, not your battery, but how much hard drive space you have on the various drives that are connected. Right now we have local storage. It's 15 gigabytes with 11 gigabytes available, 24% used. This is how you would show connection to a network. Here's how you would show how to see which USB devices are connected. It has an X through it, so none is connected at this point. And here I am on battery power, and it's showing that I have a full battery. If it was charging, it would show a different icon. And next we'll get into the various imaging parameters and how to image with your SonoTouch 30.